In November of 2009, voters passed a citizens initiative making Maine the 15th state to have a medical marijuana law. Changes to that law are at the center of a number of complaints from licensed caregivers and patients who say their rights are being violated.
Rob Poindexter joins us now from our Waterville Bureau with a look at some of the issues surrounding the medical marijuana law. Rob?
Thanks, John. Thanks, Catherine. Well, I spent the past few weeks talking to caregivers, patients, and state officials as they all struggle to find a middle ground that they can all seem to abide by. John Stewart is a licensed medical marijuana caregiver and a patient. He can grow marijuana for up to 5 patients plus himself. Under current rules, caregivers can grow 6 flowering marijuana plants per patient and have 2.5 ounces of prepared marijuana per patient. Stewart and other caregivers say there's a lot of gray area as to what is considered a flowering plant and what's ready to harvest. He says that confusion creates a balancing act for caregivers between maintaining the best possible medicine for their patients and staying within the boundaries of the law.
And we all live in fear that the local MDEA officer who decides to get a hair across his butt and come raid us is going to start counting vegetative plants as marijuana.
Stewart says the growing process can take up to 7 or 8 months if it's done right, and it's impossible to tell how much usable marijuana each plant will produce.
You can't harvest it before it's finished either. I mean, to harvest this plant now would not be providing good care to my patients. This is immature. It's not as potent as it could be.
It's like a plant. It's like a green banana, essentially.
Exactly.
Regulations that caregivers and patients must abide by are monitored by the Department of Health and Human Services. In order to be a certified medical marijuana patient or caregiver, you must have a registry identification card issued by DHHS. The fee for a caregiver is $300 per patient, and the patient pays an additional $100 before they're both considered legal. Also, patients need a recommendation from their doctor sent to DHHS, which contains confidential medical information. No other medication has this requirement.
And they're extremely inefficient. We have multiple cases of people waiting 6, 7, 8 weeks or more for their cards, though the DHHS is cashing their checks.
Kathy Cobb is the Director of Licensing and Regulatory Services at DHHS. She defends the registry card system as a quick way for law enforcement to verify who's legally allowed to have marijuana. Caregivers' frustrations boiled over at a protest at DHHS in April.
It's caused suffering in our family. We've been waiting since February, ma'am.
We have people who have submitted their applications in January and had their check cashed who still don't possess a card, which puts them in a tight legal position because as of January 1st, the law stipulates that you must be in possession of a registry identification card to have any protection from the law.
But we're processing cards as quickly as we can.
Cobb says her small staff is having trouble keeping up as the number of applicants is on the rise.
In January, we issued 204 cards. February, we issued 155. In March, we issued 287. And in April, we issued 221.
There's now 1,200 patients, 312 caregivers, and more than 100 doctors participating in the medical marijuana program. Some protesters were also told DHHS lacked portions of their confidential medical records their doctors say they already faxed to this office.
I think people want to know that if you don't have my confidential sensitive information, then who does?
We can't guarantee the numbers that are punched in to the fax machine at the doctor's office. And we have a dedicated fax machine here. So there's not very far from that fax machine to the filing cabinet for information to go missing. So, I can't explain that. But there's a balance between what the marijuana patients believe is their right to privacy and a mandatory registration system, and that'll all get resolved at some point.
Now, Kathy Cobb says those registry cards are good for 1 year. Renewal of those cards is expected to start shortly, and she says she expects things will go more smoothly once that process begins. Tomorrow night in Part 2, we'll see how law enforcement is struggling to adapt to the medical marijuana law. We'll also go back out to John Stewart's greenhouse, where he and his wife will tell us about the night they were raided by the Maine Drug Enforcement Agency. To see this story again, go to WABI.tv and click on Features. John?
All right, thank you. Rob Poindexter reporting from our Central Maine Bureau tonight.